your zip code really is your destiny. And we usually think about that in the context of, inner city neighborhood that's not so good, but it turns out rural America across the board, 60 million people, Rebecca mentioned, have a life expectancy that is now approaching almost 10 years shorter in some areas than more affluent urban areas of the country. And so the hope here, and this is, this is the Congress of the United States and the president saying, get the money out of Washington, give it to people who know more about their state than anyone else, who care deeply about the challenges of the rural areas of those states, and every state has rural areas, and get the money to them immediately. So we had 6 months, kudos to Rebecca and the team, to get the money out. The governors then, by October of this year, have to have start getting the money out of their state capitals, actually deploy all the money. That's the litmus test. And I spoke to Alina Shekai, who runs this program for us. And they've already been to 28 states. They're taking teams around. But here's the beautiful part about this. This is true federalism. We want the governors to exchange best practices, take the ideas that you think, my gosh, I never realized it could work so well, and then share with everybody else. Or maybe it's the opposite. I thought this would be pretty easy. I could just give money to nurses. They go in rural America, we give people J-1 visas, the ability to go there. No, they don't stay. So we just learn from each other and figure that out. And I've been blessed to travel to quite a few states, and I've seen it in action. I was in Iowa recently, and they have a telemedicine hub and spoke model. Iowa has one major academic center. So they don't just go out and do grand rounds with cardiology groups in other parts of the state. They meet with autism centers. And experts in the major academic center can teach those practitioners a little more about how they can diagnose and better treat a problem. In Ohio, Governor DeWine created Ohio C, which is a program to get kids in elementary school and the school evaluated and treated. So they have a measurement that results in classes being delivered to the schoolroom. We have, Alaska is using drones to deliver medications. South Alabama has many counties with no OBs. They have technologies that can allow a doctor remotely to do the imaging to decide if the child is okay. And I just came, by the way, this is not part of Rural Health Transformation Fund money, but we do have Indian Health Service. We're working together with the Chickasaw here, which I've been doing for 15 years personally, with the Kids Foundation we have that just happened to really sync up well with Oklahoma. But the reason my shoes are dusty like this, I left it dirty because while you guys were having lunch, I was shoveling dirt at the groundbreaking at Newcastle, Governor. And they will be probably the largest Indian lands healthcare facility in the country. And we want people thinking there's a future out there, getting excited about it. And the fact that Congress thought this was wise enough to do it and then give it away immediately, I think is a real testimony to the power governors have in this country.